All right, we're moving on to one of my favourite areas to work on, and that is the forearm and the hand as well. Now, obviously for our athletes and our young junior athletes that obviously play tennis like Zara does, she's a left-hander, so hence the reason we're working on the left hand here today. We've got a couple of muscles that we need to focus on. So the first ones are going to be our extensors. Okay, so they're the muscles that are involved in bringing the wrist up in that direction. So they come all the way up and attach, okay, almost to the elbow right here. Okay, so that's our focus, and they come right across the forearm itself. If we turn the forearm over, then we're looking at what we call our forearm flexors. Okay, and they come all the way along here and attach on the inside. Okay, so if we're talking about conditions, this here, if you get pain on the medial part, that's been known as golfer's elbow. If we get pain on the outside, that's tennis elbow. But strangely enough, I don't really see a lot of tennis players that get tennis elbow. But then again, maybe I don't work enough with them. Now, if we come down here, then we've obviously got the palm here. Okay, so we've got a couple of really big muscles here that relate to the thumb as well, and then obviously we've got other little layers of muscles through the hand as well. And if we turn over here as well, we've got a muscle on the outside here, and then we've basically got just lots of tendons. As you'll see, I'll flick over the tendons there, okay, and they run all the way along our hand. So in terms of massaging this, okay, that we can do, we're going to start, we're going to use the essentials, because once again I think this is the best texture for this region of the body. And it also smells U-Butte as well. So applying right along the length of those extensors. Okay, so this is just applying. All right, okay, so once again, like any of these techniques that I'm doing, it's all broad. We don't want to get involved in little finger movements and thumbs and so forth, because it starts getting really diggy and messy. And yep, I'm all about doing the broad approach when we're just dealing with offloading these muscles. Okay, so once again, we're going to come across. This is going to be my contact hand. The other hand that goes on top is the supporting hand, so the broader. So it's coming along the length all the way up and across the actual elbow joint. Okay, so we want to pick up just here over here where our triceps come. Okay, so we're working along the length and towards the outside of the elbow. Okay, like so. Okay, so we're up like so. Okay, one. Now, there isn't a lot of room here because Zara hasn't got a really, really big forearm, but if we had someone who was a lot larger, then we could probably work along the different directions. But basically what we're doing is just going from A to B, okay, across here like so. All right, now once again, we need to be mindful right up in this area here. You've got a couple of really, really specific sort of tender trigger point areas as well. So once again, that can be a little bit of a focused area for us if we're going to do smaller strokes. And you'll find that you're just going to blend into the bulk of the muscle through that area there. And I'm not going to go through the different muscles through here, this area. I'm not going to confuse everyone. But we do have a muscle on the outside here. Good one for your therapist. Okay, it comes along here. Okay, that's your brachioradial. So that's also a really important muscle. So what we can do is we can work along the extensors, but then we can turn the arm basically to that direction like we were shaking arms or shaking hands like so. And we can work along the length of that muscle there because it's really quite important, especially in tennis. Okay, be mindful that we're not going to dig into that muscle. It's going to be really painful as well. Okay, so that's what we call our brachioradialis. Okay, now if we continue on, we can then turn the arm out, and now we're working along the forearm flexors. Now you'll find something really freaky when we do this. So we can start to watch the fingers move as we work along this muscle. Okay, so I'll just apply some of the cream here. Okay, so once again, same principle. It's almost like a mirror image here, what we're doing. We're going to come in, that's my contact hand. This is obviously going to be the supporting hand, and as we work along here, okay, we're going to work right up towards the inside of the elbow. Okay, so if the pressure's right, you'll start to see the fingers moving on their own accord. Okay, bit of a freaky feeling, like so. Okay, so once again, only a really small group of muscles. So, you know, once again, my rule of thumb here, pardon the pun, it's probably about 5 minutes is sufficient of just doing this type of work. So it's just really general work. We're not digging in. We're not necessarily trying to focus too much on finding really, really tender areas. We're just dealing with the load. Okay. So like that. Now we can also come down and we can start to focus a little bit on the hand itself. So in terms of how we can do this, what I like to do is there's a couple of really good techniques that I've been shown over the years. So obviously there's the spreading motion here using your fingers, but that can really ruin your fingers a little bit, especially doing it from that position as well. So what I tend to do is I come in as much as I can and I can use just a really broad fist. Okay, so once again, it's not like, it's a little bit like what we did with the foot, okay, in terms that we blend into the palm, okay, and then we can just work across the bulk of those muscles through the hand. Now, admittedly, most of the bulk is through the outside of the, towards the thumb, and then obviously we've got that big bulk of muscle on the outside of the last finger as well. Okay, like so. Okay, so that's all we're doing, is just generally stroking across those areas. Okay, pressure that they can accept, which is okay, so we're not digging into it as well. All right, right across that way, like so. Now, the other thing is to turn the hand over, and then we can do some really broad stroking across the top of the hand, like so. Okay, and we're using basically those muscles that we just finished massaging. Okay, like so. All right, and then the final piece of response is obviously just massaging the fingers. We call this milking. Make sure that we don't disturb the nail polish on there. Don't think Premax takes nail polish off. All the way along, like so. All right, so that's the hand and the forearm. Hope you enjoyed it. Look forward to your feedback.
So, if you even remotely enjoyed some of that content, please do me a favor and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.